Okay, chapter 37, preparing for examinations. So we talked about this yesterday, but I want to review. So you're going to ensure the room is clean, well organized, and comfortable temperature. Why are these three things important? Say it loud. Why is it important that the room's clean?
So you don't transfer disease.
Okay, which we call what? Infections. Or in the situation, it would be a nosocomial infection, right? Okay, why is it important that the room's organized? Blade, you answered this yesterday. What is it?
So the doctor can find things when they...
Absolutely. Doctor has to be able to find things. And comfortable temperature. Why is that important? We didn't really talk about that yesterday.
Because can it affect when you're taking the temperature or something?
It can affect a lot of things. Specifically, if the patient's uncomfortable and you're trying to do an examination on them, they might tense up and you might not be able to access the area in which you're trying to examine, right? It affects a lot of things. So in your textbook, table 37-1, supplies and equipment that are present, that's the responsibility of a medical assistant. Position the exam table properly or appropriately so that the patient can hop on the exam table, maybe with assistance, and be in the position they need to be in. Pull down new table paper at the proper width to appropriately cover the table, and cover the table pillow. Why do we cover the table pillow?
Lice.
Bugs, germs, bacteria, all of the above. Okay, so preparing and assisting the patient. We need to make sure that our patients are comfortable. Why is that important?
Because if they're not, they, like you said, they tense up or...
Yeah, and maybe you won't be able to perform the procedure that you need to perform, right? So you're going to give patients instructions. You're going to instruct them on how to wear a gown and apply a drape, okay? So when we get back into the back of the room this afternoon or this morning, we will, I'll teach you how to position and how to drape. Allow patients time to empty their bladder, and if you need to obtain a specimen, you must do so at that time, So if we're going to do a rectal exam on a patient for hemorrhoids, why is it important that their bladder's empty? Because they could have an accident. Sure, their bladder could release during that exam. Those are things to be really conscientious of when you're doing an exam, especially in terms of like female reproductive health. If you're doing an ultrasound or something where you don't need to see something with the bladder full, you want to make sure it's empty so that there's no mess there. Using proper technique when transferring patients from a wheelchair to an exam table. You don't want to hurt yourself and you don't want to hurt your patient, right? You want everyone to be comfortable, including you. If you're lifting a patient improperly and putting them on the table from their wheelchair, what can happen to you? My nursing home employees, you know the answer to this. It'll hurt your back, right? Yeah. And then what happens if you hurt your back? You can't work, right? So it's really important that you lift patients properly. As medical assistants, lifting is not something we do an extremely large amount of, but you do assist. Oftentimes, if patients come to you, if patients come to you from a nursing home or a facility of some kind, and they usually have an aide that comes with them, and they will transfer the patient for you. But if you have somebody that maybe had just had surgery and was by themselves, or maybe is elderly and just needs a little bit of extra assistance, or whatever the situation may be, it's your responsibility as the medical assistant to ensure the patient's comfort and allow them the privacy and suitability they need to get on the table and to drape, etc. Examination positions. You all should have seen these, at least since we've started working on this chapter a little bit, okay? If you could demonstrate for me what the anatomic position is. Somebody stand up, show me the position. Stand up and show me the position. There you go, yep. It's standing up, shoulder width apart feet, and hands to the side, palms outward open. Sitting. What does the sitting position look like? Same deal, just kind of like, yeah, just loosey-goosey. Horizontal recumbent or supine. Face up, right? If you're face up, you're horizontal recumbent. What is supine? How do we remember supine? Huh? Well, I always remember it because I'm carrying a bowl of soup upward in my hands, so I can't drop it. So I have to carry it like this, right? So I don't want to drop the bowl of soup. My palms are facing up to carry the bowl of soup. That's how I remember it.
I thought supine was when you're just flat on your back.
Yeah, supine is when you're laying flat on your spine, which is another way to remember it too. Well, when you're laying flat on your spine, your arms are out like this.
Her picture just goes next to side.
Okay, or the hands can be down too. I'm just saying it helps me remember facing up. Does that make sense? Like if I'm thinking if I'm carrying a bowl of soup, it obviously has to be face up or the soup's gonna spill. So I just remember kind of having the face up towards the ceiling. That's my way of remembering it. Horizontal recumbent though, in this picture you can see, it's just laying flat on the bed with arms to the sides. It doesn't really matter if the palms are up or down, okay? But you're right, Kenzie, that makes sense. Okay, dorsal recumbent. What is dorsal recumbent? Laying on your back, knees up, okay? Feet flat on the bed or the table, knees up, flat on the back. Very good. Prone. What is prone? Flat on your stomach. Do you have any tips for remembering this one?
No.
Me either. This is one that I just remember. I don't know how to make it easier to recall. Sims. Now, there's some confusion sometimes with Sims. Sims is how 90% of the American population sleeps. You're kind of on one side, but you're like propped up a little bit, and you've got that one knee like out and like bent, and you're just like, it's like supreme comfort. That's Sims, okay? Makes sense. If you have a body pillow, you can just snuggle up with that's even better.
I do that all the time.
Same. So that's definitely a lot easier. Knees to chest. Knees to chest. This is a doozy.
Do you use it a lot?
No. We do not use knee chest a lot unless you're working in an office where that particular position is specific for the exams that physician does. If you work for a general surgeon, you're going to encounter a knee chest. If you work for, chiropractors probably encounter knee chest at some point.
Is that for like rectal exams?
This is for proctological exams and occasionally for sigmoidoscopies if a proctological table is not available. So, yeah, these are specifically for rectal exams, okay?
So how do you lay when you get a colonoscopy?
When you have a colonoscopy, that's a really good question. Let me find my picture here and I'll show you. Like this.
Where you're laying
Sims.
down.
You lay in the Sims position, yep. But because you're unconscious. Like they sedate you for that procedure. So they can't have you in the knees to chest position when you're sedated because you wouldn't be able to, you'd fall over. Wouldn't be safe. So what they do is they have you laying on your side and then they position your hips once you're asleep or maybe prior to being asleep. And then that's when they would examine with the procedure. So that's the procedure, the position they use for the colonoscopy. Does that make sense? Okay. All right. Trendelenburg. There are two. There's Trendelenburg and then modified Trendelenburg. Trendelenburg is where you're like completely, your feet are above your head. This is called the shock position. So if you encounter a patient that's in shock, you elevate their feet above their heart to return the blood flow to the heart as opposed to having it pool in the extremities, okay? And then modified Trendelenburg is similar to the straight Trendelenburg, but the knees are bent. This is so that it's not as overwhelming of a position. We use Trendelenburg for tilt table testing. Tilt table testing is done on people that have cardiomyopathy or like cardioaversions. People that have POTS disease. Do you know what POTS disease is? My daughter actually has POTS, Abby. So this table test is done to see if like they're able to breathe when their head is, they use it for a lot of different stuff. So modified Trendelenburg is with the knees bent. Trendelenburg is with the legs straight. Okay, make sense? All right, so Fowlers. Fowlers and semi-fowlers. Let me find my picture. Okay. Fowler and semi-fowler. This is semi-fowler. Fowlers is straight up and down at a 90-degree angle. Okay? Boom, boop. Straight up and down. Semi is at a 45. Okay? So the best way to remember this is 90 sims, or fowlers, I'm sorry, 90 fowlers, 45 semi-fowlers. Okay?
I just think of it half.
What?
I just think of it half of.
Half and a quarter. That's a good way to, yep. So if you're in the 90-degree angle Fowler's position, it's for patients that have respiratory or cardiovascular problems. And then if you're in the semi-Fowlers, same thing. If the patient's resting against the back of the table and it's lowered, it's known as the 45-degree angle. But they're used for the same thing. Lithotomy. What's the lithotomy position used for? Vaginal exams. Yep. That is correct. The knees are bent, the hips are at the edge of the table, and the feet are placed in the stirrups to provide support for the patient. This is also used in the birthing process. This is the position they use there as well, with some modification. And then jackknife or crosskey. Jackknife and crosskey, same thing. Crosskey is a different way of saying it, jackknife or crosskey. You have your patient with the head down, hips elevated on a table that has the triangle at the top, and then the knees drop mid-back, okay? It's easier for me to remember it as crosskey, but I think jackknife also is probably easier for people that maybe don't know a lot about it, because a jackknife truck is where it bends in the middle. So it just kind of makes more sense. These are really good for patients that are having surgery on the lower back, excuse me, tailbone, hips, etc. And also rectal exams and rectal surgeries and stuff like that. So, any questions on positions? I will demonstrate these for you in the back of the room. Well, I have volunteers that are demonstrating, and I am not demonstrating. I don't even think I could do like 3 of these. I don't know. Okay, so here's the pictures. These are posted for you on Classroom so that you can see them with a description of each position. Use your resources. I literally posted all of these to make your life easy. And that is it.